I'm sorry. Oh, the ice. I'm sorry. We'll wait till she's done. What? I don't know what. Yeah. So, I don't know if it's available.
Are you videoing like right here?
Right now.
He's videoing everybody. So you
Don't want to be in the line of fire.
Oh, you are too late.
Okay, let's try this again. I'm Dottie Briggs, I'm the chair of the board, okay? And these are some of the board members here. You probably all know Jamie Farnsworth. Go ahead, Leanne.
Nick Johnson.
And Connie's on her way. I know she's here.
Hello. I'd like to let you know that we're having a town hall with the board members in the cafeteria. If you would like to come and ask those questions, then we'll be there to answer them. The cafeteria.
Okay, I have to say, I'm sorry that Randy Lindauer Yeah. Hi, Connie. Here's Connie. Randy Lindauer can't make it today because he's under the weather. We apologize. So we hope that if you had specific questions for him, then we can take it to him, or and he'll respond for sure. So we'll make sure he responds. So I just wanted to say good morning. Thank you for coming out on this day. You know, the employees don't have a choice, but thank you for coming out on this day.
They do have a choice, and we're thankful they came.
Yeah, that's exactly true. So what we had our very first town hall meeting on Monday, and so there were lots of questions asked, all different kinds of questions. So we want to know what you want to know. So I would love for you to ask questions of us, no matter what it is, we're ready to answer.
Well, I'll ask. I got a phone call about PT. Breaks my heart around here. So, is coding no longer done in this facility?
What is it?
Coding.
Coding.
Is the coding done in-house?
As far as I know.
Then why is it that your finance committee can't, not your committee, but your billing department cannot answer questions on their billings? If the coding's done here and there's mistakes on your bills, why is it that the accounting department is not able to answer the questions? Because from the information I received from my phone call last night was there was going to be several people here that were very, very upset about that. This facility needs that. I've used that ever since day one.
Well, no, you said something about PT and then you went into coding and billing.
That's because people that are going to for PT say that they're coming into this facility because there's mistakes on their bills and the county department can't answer the questions, they just send them out there.
Oh.
Now,
Do we do in-house coding or do
are you in-house coding or are you sending it out now?
So our hospital coding is, if she's an employee of our facility, if she's off the site.
Has she been off? Oh, I see. So
She works from her home.
So who can answer the billing questions then if she's not here?
So we have the front end, I'm sorry if I'm speaking.
No, we
Sorry.
don't.
Okay, sorry, explain topic.
Tell everybody who you are.
Okay, I'm Sandy, I'm the revenue manager, cycle manager. So our gals at the front desk should be able to help you for the most part. We do have a self-pay department, and so they can come out and help with that as well. If it has to do with your insurance, we have a Medicare Medicaid that can walk you through the accounts and your EOBs and talk to you about, what was deductible, what was co-insurance, what was a denial, any of those kind of topics on your account. So then we have a commercial biller as well, and she'll do the same things and walk you through it. Our receptionist at the front desk is usually who they first have contact with, and she has limited access to that. She doesn't do billing. You mentioned therapy, and I do know that we had patient maintenance costs. It's like you can come in and have some services done for $10, I believe it is. And there was a trouble with that where when we increased the prices, it went to 11, so we had to correct those. So they would call me out, and I would come out and fix those accounts. We're talking about a handful of accounts is all. We've gotten those charges corrected, so that doesn't happen anymore. I know we had some confusion with my chart. Sometimes when the charge gets right into the account, it gives you a notification right away. And we're having some people have confusion about paying those as well online. But Weston County Health Service isn't able to utilize that My Chart payment feature. It's only for Monument Health. So when you're getting notifications, sometimes it's hard to tell if it's a Monument Health bill or if it's a Weston County Health Services. So we've worked with those people, that the IT services behind trying to simplify that a little bit easier. So we do get some confusion with that. But like some of those maintenance ones, I know that we had a couple that we had to work on. There was misunderstanding one time when someone came in and they paid today, and their today's service isn't on there. It takes another day for the charges to flip on there. And so for the service you're getting today, you're not going to see the charge yet. So we had some things like that.
But that's not the problem.
But I'm not getting a lot of complaints across my desk that, we're not able to help. So I would really like to know if we're having that issue. Yeah. So I need to see some
They called me up,
samples.
they told me there was going to be a bunch of them here today.
Okay.
I'd like to give you a little bit of my history here.
Sure.
With PT. First of all, I'm Elaine.
I was just gonna say.
I'm Elaine
Thank
Wilkham.
you.
I'm a 76-year-old PT patient. I have been for quite a while. We've been in Newcastle since 1996, and I've had several occasions to utilize the hospital services for various medical reasons and have never had an issue with service. Okay. My career background includes over 20 years of certified orthodontic assistant in expanded functions as well as being an instructor. When we came to Newcastle, I worked for Dr. Carl Cottrell, pursued courses to become a para-optometric assistant there. And in those two offices, and I worked for him for about 7 years until I retired. And in those two offices, those are the two medical offices that I pretty much worked in for many, many years, and I have had experience in billing. So for the past 2 years, I've been a patient here, a physical therapy patient. I'm extremely satisfied with the care and the service of every single person in that department. I can't say enough about their care. Initially, I was referred by my provider, which was covered by my insurance. When I moved on to maintenance program, I had the understanding and I knew that I was responsible for the $10 a time that I came, until that $11 thing came up. And I realized that that is no longer covered by insurance, and I have had no issues with payment on my part. Today, however,
Wait. Let that sink in. However,
my issue today is to bring to your attention the continual inaccuracies of the billing system, which includes statement discrepancies and errors, lack of clarity, unclear and confusing statements, and portal information, even though you say it's been improved, okay? I have had to ask on many, many occasions for itemized statements. Okay, so that shows up now on the portal, but there's no date. It gives a date range, okay? My last statement, which I paid, was dated January 1st to January 31st. It did not include on there the 2 times or 1 time left in December. So, I mean, why should I pay that December one? It wasn't on the bill. Okay. So, and I've brought this to the attention to the billing department, to the girls at the front desk, and I have talked to you, Sandy.
Yep.
And one of your answers to me was, that's the way Monument tells us to do it. I do not accept that. And I think it's your responsibility to straighten it out with Monument so that we patients don't have to go through this every single month. I've only had 2 correct statements in the couple of years that I've been here. And that's the last 2, okay? I just want to say too, it's reached such a stage for me that my physical therapy services here and physical improvement that I may have had through physical therapy, and I have had, and that's why I continue to come, is being undercut by the continued anxiety and stress over the inaccuracy of the billings, and the anxiety and the stress of waiting for the billing to come to see what's going to happen and what is going to be on that bill. And at this point, you know, and as I stated earlier, I've been a patient here several times, and I've never had these billing issues until this PT last couple of years. And it's brought me to the point of, I might not choose this facility any longer. I might find someplace else to go where the billing is accurate. Yes, Connie?
Have these statements that you're
Yes.
talking about, were these mailed to you or?
No, I chose paperless
Okay.
billing so that I wouldn't have all these
Right.
papers hanging around, you know? And again, you know, I've never really had any issues with payment or billing until PT.
So when did this issue start?
Yeah, and
Finish, she has the floor.
thank you, dear. You know, and I want you to know that, I want you to realize that I'm not here complaining as an individual. This is not just me. It's happened, and as Norma said, to many other patients. And it's gone on for a long, long time. And I want you to understand that it's not an isolated case, and that corrective measures will be forthcoming and followed through by the board and the administration. And one other item that really, and I talked to Sandy about this a couple of years ago. I paid my bill, and the day later I got a collections notice, and I had to straighten it out. So, thank you for listening, and I really hope this can be straightened out, because I really love that PT department.
Can I ask you a question?
Yes.
Is it only PT that you're having issues with?
I don't know about
People that called me said it's only PT, and they've come to the office and they've told me they can't help them. And so they're going to Rapid, and I said, that's ridiculous, I'll help you. I did billing for years, I'll help you figure out what's going on with your billing. But that's gonna get around town, unfortunately, and people are not gonna use our PT department. Well, they're not gonna use our PT department, and for God's sake, it's one of the best there is.
Absolutely.
I have used them and used them and used them and used them, and I will continue to use them, but we can't have this going on with our facility.
You know,
I don't know what the problem is, Sandy, but they can't come in here, and somebody in your department said, well, I don't know.
See, and they're trained to be able to help, so.
I understand that, I know that.
Within certain limits,
I know,
if she doesn't know how to do the billing.
If she doesn't know what to do, then she needs to get, whoever this person is, needs to get somebody in there, because it's all over town there. And that's not good for this facility.
No, I
This
agree.
facility's got enough issues right now without having to deal with something like this. And this PT department is one of the best. I think that I've used them, Jim's used them, and I don't want that to happen, that we don't have it anymore. And people quit coming here over something that is so simple that can be fixed. I don't know anything about this maintenance thing that she's talking about, because I never had it with anything that I did. And I can personally say that I've never had any issues with your department as far as my billing goes. But when they're calling me up to come to these meetings because they're sick or whatever, I'm sorry, but here I am again. And
No, we're glad you're here.
This is one of the most important places to be. I mean, remember, you know, I've worked in this facility, for this facility since 2001. I'm not one of you.
We don't either.
I know you don't, but you gotta fix some things. You just got to.
So my question is, you know, I've presented this to you guys and everybody in here. But what would be the plan? You know, I want to be informed as to how this is going to be corrected and fixed.
Sure.
And if you have to, I mean, you use Monument, and you're telling me that it's the way they want it done. Well, isn't there another program that you could use? And Norma spoke to the people at the front desk. I use my debit card. Most of them don't know how to use the debit card machine.
Oh, Lord have mercy.
You know, so I come out with I make them, I print out my statement and I have them put, you know, and back to the statements, I have continuously asked for itemized billing. And this is what it is. This is an improvement, yes, but there's no date of service. And under the general, you know, PT therapy general, that's fine. I have no problem with that. And I would like to pay my bill online. And I was told because of HIPAA regulations. Well, that's not true, because I pay all my other bills, medical bills online. I had a hearing aid issue. And my provider, I paid it online. They go through Monument too, and no issues there, so I'm just not understanding. But thank you for listening, and I really hope that you take this to heart, not just for me. And if you want to check with the PT people, you have their permission to come and ask the number of people who have left PT because of these issues.
Can I say something?
Thank you.
I think the first place that we need to start is with our staff. When somebody comes to you and they have a question or a concern, the answer of, I can't help you or I don't know is inappropriate.
Yeah.
So any department in this whole facility, if somebody comes to you, I mean, if somebody comes to me as a nurse and they ask me something and I don't know the answer, my first step should be, wait, I'll find somebody who can answer that, or wait, I'll find somebody. So I think as managers, we need to stress to our employees that that's unacceptable and we need to just find somebody that can help them in any way.
Right. So I want to say to you that I myself have never heard this problem, ever. So what we will do is, we will investigate it with the proper people and get back to you with an answer.
I would appreciate
I don't know what the time frame will be,
You
but
know,
we'll try to make it as quick as we can.
my purpose is not to denigrate anybody here.
Absolutely not.
To bring a problem.
Yes.
If we don't know about it, then we can't help you. So,
I would say that's the problem.
You
That
know,
if all of you board members have never heard this issue before, then
then there's
you got a
some
problem.
communication
You got a
problem.
credibility problem throughout the organization.
Well, we have a quality
Yeah.
department.
I have filled out the satisfaction thingy-dooey, and I did put the first time that I was unsatisfied with the billing.
Okay.
And I don't know if Kim
Did anybody
Sharp is here. I don't know who Kim is.
Kim's here.
Kim, offered to meet with me.
Okay.
I did not. I just thought, you know, it wasn't my place to fix the billing. But, and so I did communicate.
But now you've heard on a much bigger issue. We could list a half a dozen names, and these are big hitters in town who have had the same problem.
fine,
Okay.
no, I'm so glad you brought it to this
Yeah.
meeting, because it may be falling on some people that really can't do anything about it, but you know, Sandy's here, Jennifer's here, we're all here, and you know, we will take this seriously and look into it for you. We may have to contact you for details, if that's okay.
That's fine.
But, no, absolutely, we'll get back to you.
That's part of the problem. we have too many details. We have stacks of documents.
Right.
So show incorrect information that we have to correct.
Right, well, that shouldn't be the case.
Sandy, I wonder if you could speak to the monument.
Yeah, I think we contract with Monument Health for our software. It's such a robust and expensive software. It would be really difficult for a hospital to maintain that. And so we have to join their organization in using the software. So it is their IT department that helps us fix the things that are wrong in the system. And so we are busy. We have a great team of people. We're always looking at improvement all the time. And so for this instance on the PT that we did have, I reached out, we placed tickets with them. And then, so we grouped with their analysts and talked to them about the troubles we're having. And right now, as I mentioned before, my chart is one of the difficult ones. And we have looked at different ways that we can do the payment online, for instance, and we're not able to do it through their system because we're not a Monument Health facility. And Piper, I don't know if you can express any more stuff of that. I know you've worked with it too. But unlike this situation with the statements and stuff, we did work with Monument Health to try to improve that and told them that it's hard to understand when these guys are getting so many notifications. And we've had where somebody's placed a payment on there thinking they're paying us and it actually paid Monument Health. So we've had to go back and get their funds back. So it isn't something I can personally touch and fix. I can get you itemized bills, but I can place a ticket. And we have raised awareness to it, and they have made some improvements. We still need to maybe go back and look at it again. I'm not aware that we're currently having that trouble with PT, but if I'm not hearing from these other individuals, I would know that.
How responsive are they to your tickets?
They're pretty good. There's some tickets they get busy in. You know, as we have lost staffing as well, sometimes they have on their end, so I might have a little delay. But anymore, they're pretty quick about getting back to me. So like a week or two. A week or two to resolve the issue. And so we'll have several meetings. I meet with Monument Health once a week at least. And we're working on our tickets. And they're limited in what they can do in some of the, because we are, not, like I said, we're not Monument Health. So the system they have built for us is a little bit different setup. And so we're called the Connect site. There were several other communities that went with us when we did that. And so they have to pull in other analysts to help us as well.
I have another question.
Yes.
Who's responsible for entering the bill,
The charges,
the charges?
probably 90% of it is generated from the departments.
Okay,
So when
because-
a therapist does their documentation, it posts the charge at that time.
Okay, so on the same day, on my portal, I have no balance, but there is a statement here on the same day, dated January 7th, that I owe $50.
So that had to be the previous month because
So
we
why
wouldn't
is
know
that?
yet.
Why is that still on the portal? You know, I'm 76, but I was sharp enough to pick this up.
Sure.
I know people who have paid their bill and then have had to have refunds. And so,
It's at over, and like you mentioned, the letter came the same day you paid. It's crossing in the mail, it's crossing in the process. All of our services or processes run overnight, so it should correct by morning, you know.
yeah.
Isn't it the same case with the collection? You know, the collection letters go out at a certain time?
Yep, they're auto-generated out of the system and go out, just as our statements do, and those aren't in-house, those statements, so it's not like they're sitting on a desk and I can grab it and stop it because I saw a payment come in today.
Well,
We use
there
a,
has to be a way to figure that out because I have never, ever in my life not paid a bill. And I have never, ever in my life had a collections letter until that. And so, where is the oversight? You know, this is all monument, but you should have some oversight here in the hospital. And then I'm done. It's up to you guys.
and our collection letters don't produce out of our system until after a payment hasn't been made for 2 months. And then this is our way
Well, then fix
of
it.
reaching out. We put out 2 statements, and if it's not paid, the system automatically generates that on the 3rd week, 25 days later from the second deal. So we worked really hard, and we do listen in the office. We're really trying hard to help people with discrepancies, and we don't, like I said, I don't have a ton. This maintenance ones has been one that we've had to go back and look at that in my chart. And I can go back to Monument Health again, and I really want to make this work for you guys. I don't like seeing anybody dissatisfied either, as I myself would want to see that. So we really want to work with that.
So Sandy, if
Yes.
someone has a problem,
Yes,
who should they reach out to?
they can always reach out to me. I would be always willing to help. But we do have billers that can help again if it's billing questions, looking at those things.
Her was the swing voter. Right? She's very powerful. What's your, that you could talk about the chairmanship and everything else. It still comes down to you need 3 votes to win stuff. Do you think Vera enjoys that, or do you think it's just she accepts that's the job and she's taking it on herself to go ahead and be that person?
I think she, from what I gather from watching the meetings, I haven't been to a meeting in person in a long time, but from watching them and listening to it, I think she accepts that role. Obviously, I can't speak for her, but I don't know how much I would enjoy being that person. I think it's a hard job. And I think you're in a hard place, especially when you have to sit between those 2 groups of men every meeting and be that person in the middle, which I think she might be in the middle all of the way. I think she might sit between them too.
Yeah, a lot of fur flies around, Vera, and
They can always reach out to me. I would be always willing to help. But we do have billers that can help again if it's billing questions, looking at those things. Your registration staff at the very front end, they're not billers. They can't answer a lot of those questions, but they do know and they've been trained to go ahead and get the rest of us in the back. Our offices are right behind them, so they can reach out to us really easily. We have, our billers are constantly meeting people out in the front area, or we have another office that we can meet with people to go over their bills and look at the computer system with them. So we're always willing to do that. And we need to do further training too, in making sure that everybody, there shouldn't be anybody that says we don't know. You should be getting somebody that can help you.
So I will tell the people that I receive phone calls from
Yes,
that they should come back here and ask them, just ask me.
absolutely. I'd be more than
Ask for
glad.
Sandy, because
Yeah.
I'm telling you that we can't help you.
They can call any authority as well.
Well, you
Well,
can't
we
help them.
can't know.
But we can't
No, we can make sure it gets help.
Right.
Well, I understand that, but I don't think they want to go that.
This maintenance thing,
But they're very unhappy. And
Well, that's
we have a wonderful PT department, and I don't like the idea that they're getting bad reputation over something like this. And they are, evidently, from what I was.
Well, it's a shame because it's not the people, it's the system.
I know,
Because
but-
I agree with you, our PT department's stellar.
Yes, they are.
Well, I'll reach out to them as well and find out what they're seeing so that we can work on that too.
But
We should be able to work on that without the patient.
I sit on a board and they keep telling me, well, we did it this way 27 years ago. And I said, unfortunately, that is not today's world.
That's right.
We don't live in that world anymore. Handshake doesn't even mean nothing anymore. I mean, we used to get loans on our cars this way. Those days are all gone. And we have to be diligent in what we do. And I said, we can't live in 27 years ago. I want to, but we can't. So I will tell the people that I received a phone call from, that they need to come back and not go to Monument yet, and ask for Sandy, and she'll get them the help that they need. And hopefully this will be solved and go
Any
away.
complaints can always go to Kim. If you call the front office and say, I have a complaint.
Yeah.
Well, I don't think they have, I don't think they want to complain. I just think they
Yeah.
want help with
Sure,
their
with
bills.
the billing.
Yes. Want to pay an accurate bill.
Right.
So one thing we've looked at, because we don't have the capability of taking payments online through my chart. So we have looked at putting something on our website so that you can do payment online. And I'm wondering, would that be helpful to people? To me, that's a little confusing when it's not in my chart. Yes.
It would be helpful to people, but it has to be accurate. it has to be, you know, I know you're telling me it's through Monument, but on the same day, you know, I paid this bill 2 weeks ago. And so on my chart, it says I have no balance, but on the same day, it has that I owe $50.
Well, I'm gonna have to look at what my chart
And so
has.
somebody, you know,
That, and the one you're holding in your hand came in the mail?
no, I
No.
printed it off because
Okay.
I chose paperless.
So
bills.
that's the, if I got into the site, that's what I'm gonna see is what's on that statement. I don't see what maybe is in my chart. I'm going to see that
Yeah.
documentation.
And so in my mind, this needs to be taken care of. Because I know people that would say, gee, this says here, but they tell me I owe $50. So I run in and I pay it. And then I'm out $50. Or I catch it and the hospital has to reimburse me the $50. And so, I mean, that's not saving you guys money.
And some people won't catch it either.
And a lot of people haven't caught it.
They won't catch it.
No, and they're prone to paying the bill. They get a bill, they pay the bill. And I think sometimes, and this is something we can't control, but I think sometimes my chart could be confusing to people that are not real savvy, because you can pay a monument bill on my chart, but you can't pay one here.
Right.
So I think
So
that
that
would
is
be helpful to
clear.
look into.
Yeah. And I was suggesting maybe too on my chart, you're able to respond. You can ask questions on there.
Right.
Monument Health does screen those questions and then they'll send them back to me and I'm able to answer it through there or look. And the majority of what I get back is I can't figure out how to make my payment online. So I'll document back to them that we can help them and here's the phone number they can always call. And then I forward that on to my self-paid representative so that they can reach out and ask them if they can help them. So we do have that communication through my chart.
Right.
And that's working, but again, it's screened by Monument Health, so it may take a few days for me to get it.
Would it
We
be
do have
fair to
that.
say that if they get a bill but they think they already paid it, they can call your department?
Oh, absolutely.
So they can look
Yeah.
into it, because they can look into it.
I
So,
know.
and I know it's just another step, but it's something for
Well,
now.
and I can give them samples like this and we can train and look
Sure.
at that.
You know, as the patient, you guys are the service providers, and as the patient, I expect a certain, what's the word I want?
Level of excellence?
Yes, you're exactly right, thank you.
We settle for accuracy.
Yeah,
Okay.
yeah,
No, well, we settle for excellence.
well, that would be good, but
It's not
let's
there.
start with the accuracy.
Right, get you.
And I'm probably talking too much, but, you know, you're telling me monument. Where is the oversight here in this building, in this office? Somebody has to be checking these bills. I mean, I would hope so. I mean, you're just not taking it on faith that monument is gonna have the right, information.
Yeah, but we do review, especially if there's an outstanding balance, we're looking at those. Like I said, I can't see into my chart to see what you're getting on that notification, but I can see the stuff that's on the accounts, and so we're working those accounts.
Okay.
We appreciate your input because we all learn from that. And I definitely will be sharing it with our
One
staff.
more thing and then I'm
Yes.
done. This has been going on for 2 years.
Wow.
Okay.
So, and I
And it's all
have,
news to you.
It is
and it's all news to you guys.
Absolutely.
So where's the communication? I said I was done, sorry. Thank you for
That's
listening.
okay. Anybody else have any questions or
Can we
concerns?
touch on why our HR director was put on administrative leave?
That's not for discussion here.
And not even why we're not supposed to contact her at all?
That is a personnel discussion that is not appropriate for here.
Okay, so what are we doing about that though? Like,
We're not discussing it at this meeting.
we're not even like clarifying it with, the community on why things like this are happening so often, why so many employees seem to be leaving. Like, I don't know, it's just frustrating, I think, for us staff. We have so many staff members that have left recently, and it seems to be like nothing's helping. Like, nothing is getting fixed. Like Angie just left. She's been here for how long? She was amazing. And it's devastating that we lost her. It just seems like nothing is helping. Like none of our complaints, none of our concerns, none of this is ever getting resolved.
I can address that for you, and it goes back to a Wyoming state statute, 14-4-401. Huh?
I know why it can't be discussed.
It is according to statute. There are certain things that take place in executive session only. They can vote on hirings, firings, whatever, in open session. But when it comes to any employee or officer, those issues that arise are executive session only, and that is by state statute.
Yeah, 100%. Yeah, it just stems that it seems like it's trickling. It just keeps trickling.
Well, there's a few things. One is that we can't control when people want to make changes. That's on them, and we wish them well. The other thing is that you have to keep in mind there are certain things that occur that are confidential or personal. And if it was you wouldn't want people to know it either. So, those things we take care of, we're aware of. I don't know if people keep leaving and leaving, everybody's leaving. I don't think that's a fair statement, but I think that there's some issues that we're addressing, and we're addressing it aggressively. So, that's about all I can tell you. I'm sorry, Kelly.
I think what she's trying to address is there a staff morale issue here? Is that why people are leaving? Yeah. Or is the board open to hearing staff concerns?
Constantly.
So they can approach the board or a board member about any concerns they have here at the facility.
That's
They
part
can
of our
approach,
job.
but we can't solve it in that conversation.
Correct.
We're going to have to come back as a board. I think that's sometimes been issues in the past where they'll come to just one person and want it fixed, but
We work as one. So.
Yeah, we have to do that.
Can I say something? I think I know exactly what she's saying, and I'm hoping that you guys are hearing it, because I've been here almost 20 years, and the morale around here is in the toilet.
On the bottom.
Every single department. So I think as a board and as administration, you guys need to hear what she's saying, because I think that's what's happening is the morale and everything else that's going on, and we're frustrated because we don't know what to do about it. And it's more than her department, it's more than the nurses department. And if you guys can just get us all together and listen to what we have to say, I think it would even just make us feel better about what's going on.
Now, once again,
Thank
is this
you.
the first time you've heard this?
No.
No, because we're aggressively addressing things as they occur. And we're doing the best we can to make improvements.
I will say this, and I'm not making excuses, but I think there's a trend in America right now, and in particular in healthcare, that there is a lot of dissatisfaction. I mean, a lot, I'm not saying that's an excuse that's happening here. That's not what I'm implying. But I'm implying this is a big problem that we're having, right? As a culture, with a lot of job dissatisfaction, a lot of people jumping and so forth. Healthcare, people aren't going into healthcare. We don't have the people replacing. So this is a national problem.
And we've had a lot of change. And change is kind of rough in the beginning. So, we're dealing with that as well. So we're aware, we're dealing, we'll continue to deal with what we need to do, for sure.
I think what's most helpful if people can give us very specifics rather than, I'm not happy, and I get it. I've been not happy in my life. But I'm not happy isn't as helpful as this is what I'm seeing, like you brought. This is a billing issue we're having trouble with. Yes, specifics.
So I can give you a specific, but I would prefer to meet with you afterwards.
Absolutely.
And without anybody else here.
So if people can give us specifics, then we can address specifics. But in general, morale is low. What does that mean? You know what I'm saying? Does that make sense?
As a citizen, that do the employees here feel that this board is open to listening to what they say?
Yeah.
Have they given them
I
that?
do,
Pardon me?
and I do, and I know from experience firsthand.
As long as you're given that opportunity.
Well, I think that's why we're here.
You feel confident in doing it.
I was gonna say, I think that's why we're here. I think this is the purpose of this forum, is so we can have these conversations, this dialogue. This is the starting point to me.
I understand.
And that's, I mean, it's communication. And I think you see that, and Connie addressed it. My job, it's communication. How do organizations communicate with their employees, the stakeholders, people like that? I think this is a great way to get that out there, is we've got to communicate. And we're hearing things that we didn't hear about. We're hearing things that we've heard some things, but we don't know specifics, but we're aware of it. But the only way that these things get fixed or even addressed is through communication and dialogue. And in this forum right here, although it might be a little hard for some people to be a part of this and some people are angry, we have to have these conversations if we ever want to move forward. And I think I'm happy about this forum right as it is. And now how do we just keep building on this, and how do we actually make real change instead of just talking to it to death?
Well, I think it's a good thing to start, but I just, as a citizen, I just wondered if the employees felt comfortable coming to the board.
I would say I do feel comfortable coming to the board, and I have in the past. Do I think it always seems like it's taken to heart and it's actually like something is getting done about it? Not always. And I think we need, just in general, collectively, we need to start from the top, and we need to fix things going down. But it seems like some of the things aren't getting fixed. And I would love to meet with all of you one-on-one and talk about that for sure.
Are we allowed to meet with, are employees allowed to meet with the board members one-on-one, or even come to you guys? Is that in our policy to do that?
Like I said, the board works as one. If there's an issue and you have something to talk to the board about, you can bring it to the board and we'll discuss it as one, as the board. Yeah, you can't discuss things with an individual and expect an answer from one person, because that's not the way we work.
Well, it's not a good plan.
No.
That way.
Right.
Ever,
Well,
with
yes.
any board, it doesn't.
Absolutely, Norma, because things get, you know how things spin out of control. And, sometimes things we don't know about things until they're escalated to the max. And if we had just known about it at the beginning, it wouldn't have gotten there. So.
I understand that.
Keisha, go ahead.
Just a quick question. So if someone, just people that have been in the community a long time, they have, history with one of you individually, if that person feels more comfortable coming to you individually and saying, hey, I need some guidance on this, I'm not sure where to go, can that person on the board say, I would recommend you do X, Y, and Z, come to the next board meeting, let's set up a one-on-one or whatever? I mean, is that appropriate if that person just feels asking for?
You could get direction from anybody.
Okay.
You just won't get answers.
Absolutely.
Yeah.
Okay.
They can make recommendations.
Yes.
And typically when we get something like that, then you just refer to the grievance policy if there's a grievance or whatever. Or you can talk to us in exec session.
And a staff member can do that if they have a concern.
I would start with the exec session.
Right.
Yeah.
Okay.
Yeah, this board is very open, and I don't think there's anybody that cares more about the hospital than maybe Norma. But, but I'm saying that we all care about the people, the community, the institution itself to be the best it can. And we're trying to deal and work with all the changes, get things on board, try to get things straightened out, answer questions, solve problems, and that takes time. So the sooner we know, the faster we can take care of things.
Take a moment to address your financial officer leaving, and at least according to the newspaper, an out-of-state finance company or finance organization taking over your finances.
Right, let me tell you what I can, because unfortunately, like I said, Randy can't be here because he's under the weather. But we had a CFO here, and unfortunately, he had to leave. And what we did was, Randy contacted 3 different organizations to see if we could have a financial assessment done. So what we did as a board is we had a presentation from these folks from Texas, and their specialty is critical access hospitals. So we did not hire them to run the finances. We hired them to do an assessment to see what our finances look like, what is good, what is not so good, and where we need to go in the future. What will happen from there is a matter of something that we have to decide, is do we stay with that group because, you know, we like what they say, what they propose, or do we start our search again, or, like, we have a lot of options. But right now we have that's all they're doing is an assessment. They are not managing our finances. Does that help?
Thank you.
You're welcome. You want to add anything, Ms. Treasurer?
Well, we think
Well, I'll add while you're thinking.
part of this group that came in as financial is that they will do training with our office staff if they think it needs to be. So they address those things.
A little bit louder. A little bit louder.
Louder?
Yeah.
I don't think I can.
Okay.
Anyway, they will address those things that they think that needs more training in areas, AR, AP, those kinds of things, account reconciliations, those kinds of things. So yeah, I think it's a good step to try to figure out our finances to make sure that we have good data, that we can make better decisions.
An outside source and unbiased
Yes.
is what we were looking for.
Right, for sure.
Kim, you had to.
Yeah, so back to the staff morale issue. I think, Connie, you kind of hit it on the head. Is, you know, nationwide there's a shortage. A lot of people aren't going into this profession. So I feel like if there is a staff morale issue here, which it sounds like there is, that it's really important to try to keep the good people we already have, because right now the manor is not operating at full capacity, and it's due to this limited staff that you already have. So I do think that's really important for the strength of this hospital, is to keep the staff that you have. And I know you're working on adding more staff, which helps the financial strength of this facility. And I'm on Norma's path. I want to see this place succeed. Anytime I've been asked to vote for money in the past by the hospital, I've always voted for it. So I do think that is a big thing that needs to be focused.
It's the foundation of which
Right.
everything else is built.
Right.
And I think our current employees are extremely important to us and the community. And I think maintaining staff is extremely important. You hit it on the head. And that should be a goal, and that is a goal. So, and just to add to your comment about the manor again, I don't know, did I tell you the other day when you were here that we're shut down because of COVID?
You were talking about flus, COVID, all these different communicable
It's getting
things.
better, but they can't take anybody when there's a COVID outbreak or a flu outbreak or so.
So you're saying if there wasn't a COVID outbreak, you would?
We would have more than we have now. Yeah, we've been, I think the tops lately was 45. And we've had multiple deaths, and now we have COVID. So you should see that increasing and getting better as time
Remind
goes
us
on.
again what the capacity is over there.
58 beds.
I know it's 50 something.
Yeah.
So you're saying you would have 5 or 6 openings if it weren't a COVID outbreak?
Well, actually, we talked to Melissa today in quality, right? Kim, do you want to speak to it or?
Yeah, so we're looking, she said that we've got a couple on the intermediate swing bed that we're looking to bring over. We've got some out in the community that we need to bring in. We're just kind of on a hold right now until the COVID resolves. We don't want to bring anybody in and get them sick. So once that resolves, we'll start taking them. We like to take them about 1 a week, just so that they can get acclimated to their surroundings. And the CNAs have more one-on-one time to get to learn that resident, instead of taking 5 on and trying to learn 5 new residents at once. So we'll start taking them 1 at a time.
So it seems like your name is always coming up when there's an issue, because you're quality control What exactly is your position, and do you take every single complaint at this facility?
I should feel like it sometimes, yes. So I do my best to follow through on all of them, you know, they don't follow up with me. It's hard for me to resolve issues, so.
She does corporate compliance as well.
Right.
Risk management, corporate compliance.
Yeah.
CNA class.
Yeah, we just did one of those, so.
Anybody else?
I just want to let you know what a great job Stephanie has done downstairs in materials with this new Sage. I mean, we've been kind of struggling with it and without much training for us to put the orders in, and she's really helped us. I mean, she was struggling too, but she's helped Lisa and I kind of get through this. We just want to know we appreciate her.
Oh, that's fantastic, thank you.
Yeah, we just had a new software that we're trying to replace Meditech. And Meditech's where we get a lot of our financial reports. And so we bought a system called Sage Intact, and now we're trying to integrate to here. And so we have glitches. But
They can't hear you, Leanne.
I'm sorry.
I'm sorry.
I have a paralyzed vocal cord, so I'm sorry, I can't.
I can talk
Here, I'll get it.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Sorry, I'm sorry. I have a paralyzed vocal cord, so I'm sorry, I can't.
I can talk.
Here, I'll get it.
So we do have a new accounting system, and we went live as of February 1st. It's been quite a challenge to go from Meditech to Sage, and we have run into some glitches. But one thing that I really like about the new system is you can go in there and you can pull reports out. Like if you have a question, I can go in there and I can pull a report out, and everything is electronically scanned. So like anything that I pay out of the hospital district, I scan all the invoices and attach it to the check, so it's electronically. So if there's a question, you can go in there, you can click on the check, and then it pulls all the documentation up. There is some really good benefits to having the new system after we get through the hurdle of, you know, all the glitches and all the departments coming together. But overall, the new accounting system will be able to give us a lot more reports than Meditech. Meditech was kind of like a Barney system, and a lot of the entries were manual entries, to where Meditech or where Sage is not so much manual. So there is some good benefits that will come out of it.
Now, when you say Barney, I think of dinosaur.
It's kind of a dinosaur.
Meditech was a doctor.
So I am Jennifer Stalkin, and I am the APPR specialist. I do have my title as an accountant, but I oversee all of so every morning I oversee all of our checking accounts. I account for every dime that leaves the hospital district, and I oversee the cash that comes in. I do payroll. I was really proud this month for January because we put a little over $1 million in our savings account, so that was awesome.
How much in that? How much are we to so far?
5.5 million.
Or that's with the CD included.
Right.
Yeah, with the CD included.
Right.
700,000 of that cash that we put in, we did two $300,000 deposits and $100,000 deposit, and then another one that was like $322,000 something, but that's for an oxygen grant. I think our interest is 5.09% in the money market, so that's the best place to keep our money. I have seen a huge improvement on the AP side of things. It seems like we have a lot more money than what we used to have, and I'm really happy to see that.
And we haven't tapped into reserves.
Yeah, we haven't tapped into our reserves in 3 or 4 months.
Right. And that's our house.
And 3 or 4 months. It used to be 500,000 to 700,000 I was pulling out of there just to make payroll and then holding the AP bills.
I know it's been reported that we had $3.1 million loss, but that didn't take into consideration our mill levy, taxes and stuff, and so really it'd be about 1.7. So, but that's been happening for several years. I mean, it's kind of, when we look at the audits. Yeah. When you look at the audits, it always shows an operating loss, but we have other funds coming in, so it kind of offsets that.
Anybody else?
No, but I hope you'll have more meetings like this. I think it's important to this facility at this point in time.
And that's why we're doing it.
I know,
Randy
but
plans
there's
to
too
do
many
it once a
rumors
month.
and take care of a lot.
Right.
Well, see, the rumors, I personally, and I know this is a huge thing, but if you have a question for me, call me.
Yeah, I know. I understand that, but not everybody does.
Because I am terribly transparent. I will tell you the truth when I can. And all, like I said before, myself and the board has nothing but this facility, our employees, and the community at the top of the list.
Connie, are you on the foundation board, please?
I am.
Would you let your president know that I'd like to attend the next meeting to talk about a donation? You won't call me back.
I will.
Thank you.
And she will.
Oh, I know she will. I'd like to hear.
Walter?
Just two things. One is for employees. I was hearing about the morale, and I heard the concern here. And I was not trying to dismiss your concern, but I deal with public meetings all the time, and they are required to not divulge certain information. All of that can be, you just look up Wyoming open meeting laws. You'll get why they can do what they can do, and what executive sessions, why that is there. And it does address certain things that have to remain confidential. And employee situations, litigation situations, whatever it is, those need to be remain confidential so that they don't expose themselves to lawsuits. But I do also have a suggestion for the board, and this is just after having processed, I don't know how many meetings, 3.1415, there you go, pi. Oftentimes in those board meetings, I see this person talking, and then all of a sudden this person hasn't stopped, and this person's talking, and then that person's talking.
We try to control
and
it, go ahead.
excuse me, but I don't see that happening.
We
that
try, but go ahead.
I raise my hand,
Yes.
That might help you guys out, and it might help as far as some of the confusion for the people who watch these. Because I go through sections of your meetings and I go, what was that about? And I have no clue.
Well, you know what, Walter, you're not going to believe this, but it's actually better.
Actually, I have seen a little bit of that. 4 or 5 months ago, though, there were 10, 12-minute sections. I couldn't tell you what the meeting was about at all.
Some people get on a tangent and it's tough to stop them, but we try. So
okay.
I just want to say something to your statement just for me, is that just because we can't talk about some things doesn't mean that we don't care and that we don't address them and that we don't do the best that we can with what we're dealing with. It's just difficult sometimes.
And some of it you cannot divulge.
Right.
And I do get that, and I just wanted you guys to know that and I'm not for the board, I'm not against the board. But I don't think people are aware of how serious it is on certain issues. that you cannot divulge. And I just wanted to make that clear. They're not trying to, I don't know if they're trying to listen to you or not trying to listen to you. That's up to them and between you and them. But I do know there are things they cannot discuss. But I did want to address you personally because I wasn't trying to dismiss what you were saying either.
Does your board have to take the board training like the rest of us?
Yes.
The required board training?
Yes.
So I was told that, because you took that training that I took, that if we sent that into the state, of course, I don't know what I did in my certificate, so I'm taking it again anyway, but we do have one board member on my board, and they want to know if they have to take it again because of that. And she said they just need to call me and I'll tell them if it's going to take care of the requirement.
Okay.
There's a new board training that's mandatory this year that we're actually holding on March 18th.
At 4 o'clock.
At 4 o'clock, and it'll be in the boardroom, and it is open to any board members because it's not specific just to us.
Right. I was invited to go with the city council. I'll probably just do it on my own. I took the same board training you did, but I don't know what I did the certificate, and it doesn't matter, I wanted to take it again anyway.
Yeah, me too.
So I just wanted to do it, I had to take it too.
While we're here, could I kind of assess, we bought the clinic across the street, we were thinking about moving it over here. Because when we bought the clinic, there's changes that we're gonna have to put in. And so we were looking at grant money for that. And, but then we originally got the grant money based on a bid, but by the time we rebid it, it's like double. So now we have to go back to the drawing board. But I just wondered if people thought about moving over here from that.
They don't understand that. I say the majority of the people in this community do not understand why you're having to do that. I understand it because Lanny and I have discussed it.
Right.
But I bet the majority of the community does not understand why you're making the transition.
And that's the other thing I want to address.
And I know it's because of the pain.
Right.
But I don't think.
No, it's not only
Well,
just
no,
that
but it's part of it.
Yeah,
That's
part
a
of
big
it.
part
Yes,
of
it
it.
is.
But I don't think the majority of the community understands. They just see more expense for this facility, and you just got done doing this big renovation. Now you're going to tear it all up and start over. I think you need to let them know the reason that you need to make this transition. It's not something necessarily you want to do. It was a good thing when it happened, but now it's not.
Right.
Right, and it's a little bit on hold because we found that there's more money involved in the money that we need to do the renovations here. We need to ask for a new grant. That building over there, one of the reasons besides what you said is the fact that it's very old and it would cost a fortune to bring it up to code. So, Keisha?
So with these two lots becoming available now,
I'm sorry?
with these two lots, right, is this one, are you guys looking at that as a potential? Because as someone who works here, just the thought of moving a clinic into this building, it would almost be very just crowded and kind of a cluster, if you will. And I think that moving, if we were to move like the C team downstairs, that kind of gives the perception that it's a closed door. And that staff is not, if we move the board down, move everything down, having patients being bounced around if this facility kind of pigeonholes us. Is that an option now that those two lots have?
That will be addressed at the next board meeting.
Gotcha.
Yeah, it hadn't been on the table.
Right.
But wasn't even
It
an
just
option.
popped up.
Right,
Yeah. Which I think
because
is.
that would be awesome. I mean, that would be ideal. That's a perfect area to expand to. Like,
Right. Do you guys know what she's talking about?
Yeah.
Okay, good.
And then we have the property on the west over there too.
Do you guys know? Okay, good.
Speaking of foundation, I do want to get a plug in. Free, right? We're having a fundraiser for the scholarship program for the hospital through the foundation board for daddy-daughter, but we don't care who comes. Dance at the Senior Center on March 23rd, starting at 6 o'clock. And tickets are limited because of space, so if you're interested, look for it, contact any of the foundation board members or whatever, because we think it's going to be a lot of fun for the community. There's already been great donations, community support.
What time was that?
It's going to have, it starts at 6 o'clock and runs through 9. We also have, as part of that ticket price, which is $25, a free limousine ride. There will be a photographer present. Some of the businesses are willing to work with people for dresses, for makeup and hair and photography. I think I mentioned that. Apologize. Yes, it's a dance, so we will have music. So
Music is my favorite part.
What about the dresses? Is he going to donate some dresses?
He does have some available. We're working to get that more available.
Yeah,
So, they're for tiny people.
Where are the tickets available at again?
Right now they're online. We're waiting to get some physical tickets, but you can do them online.
I think Randy Scola is,
Sagebrush Marketing is doing.
I'm so sorry. Randy Scola says no little girl that wants to come should not be able to come. He will make it happen.
Right. And there's VIP parking if you want to pay an extra fee.
So when you say that, that means like they'll pay for the tickets and pay for the dress for any little girl that
Actually,
wants to go that
we
can't
have some
afford it?
donations that have been provided by community members that if someone is unable to afford this, that they will fund it so that they can go. But because we do have limited capacity at the senior center, we have to limit the number of people. So tickets are,
How many tickets are there?
Is it 200?
Pardon?
I think you said 150.
Not as a couple.
As a
Yeah.
Yeah.
It's maximum 300 in the building, so.
We saw you up there and they said, Norma, what's she doing up here? She's taking pictures. And I said, well, they must be happy you've been. Oh, are you sure? And I said, well, no, I haven't been told. But I said, she's taking a picture of capacity and different things. I think they must be having something here. I'm sure it's fine.
But in response to you, Norma, when you said the community needs to know, that's exactly why I think Randy is going to start meeting with people at the senior center and wherever to explain and ask questions and that type of thing. So we're getting more out to the community because we know this is a problem. And we want to, again, be as transparent as possible. Because it is your facility, it is our facility, and we want to keep it here.
Please do.
We will. I mean, we're doing everything we can.
Because I'm going to need that room over there.
Yeah. So will we all.
At some point. So, anything else?
I do gotta say that I am really proud of Michaela, even though she's not in here, that she was brave enough to speak out.
Sure.
We had an open meeting, and the whole point of the town hall meeting started because the employees needed to have that time to come to Randy, which is the CEO, and maybe the board members can discuss issues or just have an open platform to say how you feel. So for the fact that she just was so blatantly open with how she feels, I'm proud of her for that. Because that takes a lot of courage to sit in front of a room and call things out when it's not so easy to talk about.
I'm never bothered by that either.
No,
personally.
never.
Yeah. No, but we don't know if there's a problem, we don't know. And we can't fix it, we don't know, so.
Well, and I think the main thing is, you say you can't say anything about it, but you need to listen.
Well, we know.
You still,
Listen all
like
the
Nick
time.
said, there has to be communication.
It's true.
Because then you don't know there's an issue when you don't
honest to
listen.
God, there's nothing we don't listen to. Trust me. We listen. I listen. They listen. We're one part of this job people may not know is that for the chair, it's almost a full-time job. And it's a volunteer position.
Yeah.
Same thing with these guys. Different levels, different times, but everybody puts in a lot of work to do this. And part of it is to listen and make things happen and do it right. But saying that I'm gonna send a piece over to the paper soon to give the description of what the board responsibilities are and kind of the timeframes that we have, because it's an election year. Just so, go ahead.
And like they brought up here, communication is important, but that doesn't help, for instance, when her bill is constantly wrong or other issues. So communication's great. Doing something about it is also great. And I think that's what the community wants to see, is action on these problems.
Right.
So
Hopefully the community and more of your employees realize that you're open to listening.
Oh, yeah.
That's very important.
it is important.
Well, you need to spread the word, because
I can handle
there's some things where we have a website, some people don't see it. We have things on Facebook, people don't see it. It's in the paper, they don't see it. So just like the foundation dance, that's been in the paper, and not in the paper, but on the website for quite a while.
I've seen the posters.
But some people just don't go there. So word of mouth is faster, and more satisfying. Like you get,
I think maybe that when I tell them that Sammy's going to help them, these people have called me, I think, absolutely, it will happen. And we'll get it fixed.
I do have one question though, if you can answer this. I heard that there's this connection between the billing between Monument Health and Weston County Health, and yet Monument Health is not really involved in this place.
Right.
Why is there that connection? Because that just seems like a level of complexity that I don't understand. And I think that's...
No, well, it's a computer program.
Yes, I understand that.
It's
But when
not-
you don't have the control of your own computer program, and it is up to Monument Health in this case, am I correct in my assumption there?
It's a cooperation. It's an agreement.
But
we
I-
have an agreement with them not only for the EPIC system, but for multiple things, so that it's.
Why was that put into place like that, though?
Because it was put into place when we had a management contract.
Right.
Well, and so when the management contract disappeared, then we still had this contract for Epic. And everybody we've talked to, as far as administration, they can't believe we have Epic, because it's such a vast and expensive program, and everybody uses it nowadays.
Mm-hmm.
So they can communicate, we can communicate with, send your file or whatever to the Rapid if you're over there at Rapid, or wherever anybody else has Epic. So the convenience of it for the patient is what we want to continue. That thing costs us about what, $25,000 a month?
But it's still, we couldn't support that system on our own.
No, and they wouldn't sell to us on our own.
No.
So we went in, we're not the only ones on it. I think Phillips is on it, I think Hot Springs.
Yeah, radiology example. We have a doctor at Monument Health that puts in an order for a CT scan per patient. I can see that order through Epic, therefore they don't have to fax us more.
Right.
As long as they assign it to us, it's called Community Connect. It's hugely important. I can message doctors at Monument, nurses at Monument to get answers a lot quicker than making a phone call and getting a phone call back within a week. It's fantastic. I've worked on multiple, EMR systems, and it's one of the best. It's
Correct my
the same thing.
thinking, though, if I'm wrong on this. But what I'm hearing here is that it's such a great program for the staff, but when it comes to the patients and the mistakes that are happening on their billing, I'm not seeing that there's a connection between your great experience with this program and what they are receiving as their billing goes. And there is a disconnect there that I'm hearing.
But Walter, there's one thing, that's a problem, and it's a big problem to the community, but it's this big compared to as all the stuff that's handled through that system. It's huge.
Well, and patients can set up their MyChart as well, which is another communication tool for them. I'm radiology, so I'm not the billing side. But it is a huge benefit to patients as well. It's not just us as staff. Patients can message their doctors, they can message us. That's a fantastic tool these days instead of sitting there on hold for 30 minutes, I think that's a huge benefit.
Well, and they see all their records.
Exactly. And they see their records from...
results.
Yeah, hot springs, any Monument Health facility, us, like that's a huge benefit. Whereas, say, another facility, I mean, I can communicate with facilities in Denver. Like, that's pretty nice to be able to do that.
But the problem is billing.
Right, and I understand those are two different things, but it's just an example of.
And any problem you're having is a big problem. I'm not trying to.
I'm glad you said that.
Yeah, I'm not trying to minimize your problem. What I'm saying is, with everything that goes through Epic, you know, it could be a disaster. So hopefully, you know, working with Sandy and whatever we can find through the billing, whatever, we can get an answer to that for sure. It doesn't mean it's too small. It just means that it's a piece of a huge puzzle. That's all I'm trying to say.
Well, we've identified we have this trouble with the maintenance piece, but we don't have, I'm not seeing issues across with billing. It's accurately billing. It's a lot better than the systems we've had before.
How many systems have we had before?
Well, I've been through 3,
Yeah.
3, 4.
And they're not cheap.
Yeah. And we had dysfunctional things in those systems.
Right.
Because they had to be maintained by other people. Like Monument Health does a really good job on their IT side of that. And we're
So you
getting
have that
payments in
support.
faster, they're more accurate. It catches a lot of our coding issues. There's a lot of scrubbers that are built into that software, so it's really robust in what it can do, and it catches a lot of things that help out billing. It's taken
I
a
think,
lot.
if I'm hearing it right,
Yes.
so that system does your billing, it helps you with coding and all that, but when there's an issue, you can't manually go in and fix it. You have to rely on Monument to fix the
No, I can fix it. I can fix anything in our system except for what in that line chart. That line chart notifications. So that's where I put a ticket in under the Monument Health.
That's a good clarity.
Yeah.
It's the line chart issue, not the bill.
Yes.
What
I'm
is
able
the-
to look at the accounts, pull up charges, correct charges, print out any documentation you need. any
Once
questions.
it's, you put a ticket into Monument Health though,
Yes.
it's in their hands. What is your checks and
It's
balances?
still my responsibility though too, it's my ticket, I watch my tickets
Okay.
and like on something like that, we got it fixed, we thought, very fast, so I need to go back to them. And I'll be reviewing the case again and ask what we can do more. And they listen, they want us to work as well as we can. But they do know we do have a little limitation in the line chart area.
So if they meet with you after this meeting, you could look at the bill she's talking about, the $50 bill, and look it up and say, you're right, that was an error, and we can get
Yes.
them back there. Okay.
Because you can have posting errors. Maybe the payment didn't make it to the account. We look at all those kind of things. We look at what was billed.
This has been going on for 2 years though.
Right.
And so, you know, and I have met with you.
We have to look at that. And I know Piper has taken some documentation from you. She'll be looking at it as well. Yeah, try to get that resolved for you.
Thank you.
Yes, thank you, everyone.
Thank you. Anybody else? Otherwise, we'll meet again sometime next month and make sure your date gets out. We'll be back to you guys. Thank you for coming.